Hello, welcome to the Evexia Diagnostics video series on ready-to-run Evexia panels. This is Part 4 and will cover an overview of Specialty Panels, Part 1. Now, the presenter for today's topic, the Director of Clinical Support and Education, Dr. Wayne Sedano.
Hi, this is Dr. Sedano, the Director of Clinical Support and Education at Evexia Diagnostics. Welcome to the Evexia Diagnostics Specialty Panel Overview, Part 1 of 2. This presentation reviews the analytes included in each specialty panel and their clinical usefulness. So let's get started. So in Part 1, I'm going to review the three specialty panels you'll see on this slide. There's a comprehensive detox panel, comprehensive diabetes panel, and the comprehensive diabesity panel. Now, this detox panel is going to provide a non-invasive laboratory assessment of the capacity of liver detoxification, as well as assessing for exposure to toxic metals. Next is the Evexia Diagnostic Comprehensive Diabetes Panel. Now that panel can help identify individuals with insulin resistance or prediabetes who are at risk for developing diabetes. Recognizing risk means earlier intervention to stop or delay the progression to diabetes before it becomes a more complex problem to manage. Next is the Comprehensive Diabesity Panel. Now this panel is tailored for individuals that are overweight or obese. The Evexia Diabesity Panel, it can help identify individuals with insulin resistance, prediabetes, metabolic syndrome, as well as cardiovascular disease risk. Remember that obesity is strongly associated with the pathogenesis of type 2 diabetes, hypertension, and cardiovascular disease. And recent studies have suggested that adipose tissue may play an important role in the development of these conditions and their complications through the secretion of various bioactive molecules from fat tissue known as adipokines, and I'll be talking about those later in this presentation. The other great feature of the specialty panels and all Evexia diagnostic panels is that they come with a functional health report. Now this type of report looks for early changes in blood chemistry that can indicate the risk or potential presence of many health conditions. Some of the benefits and features of the report include optimal and standard reference ranges, a historical comparison of previous blood test results, and details about each analyte with nutraceutical recommendations. Now, each of the three blood panels contains core analytes and tests that are listed on this slide. They each contain the CBC with differential, comprehensive metabolic panel, C-reactive protein high sensitivity, F2 isoprostane creatinine ratio, hemoglobin A1C with average glucose, lactic acid dehydrogenase, serum magnesium, pyruvic acid, uric acid, the urinalysis complete with microscopic examination, vitamin D25 hydroxy, and Rbc or red blood cell zinc. So let's take a look at these analytes and tests that are the core of these three panels. First is the complete blood count with differential. Now, the CBC provides a substantial amount of information that assists in the diagnosis and treatment of many conditions such as anemia, infections, cancer of the blood cells, inflammation, environmental toxins, renal disease, liver disease, autoimmune disease, as well as nutritional deficiencies. Now, the components of the CBC are listed on this slide. Next is a comprehensive metabolic panel. Now, the CMP is a group of tests that measure several different substances in the blood that provides information about electrolyte balance, liver and kidney function, glucose regulation, and the level of proteins. Next is C-reactive protein. That's a protein that's made by the liver in response to inflammation. Now, the level of CRP will increase in the blood with inflammation anywhere in the body, and high sensitivity CRP is useful to identify cardiovascular risk. So here's another great clinical pearl. Obesity is a major factor associated with elevated CRP in individuals with metabolic syndrome, and CRP can also be used with elevation of environmental toxin exposure, including lead. Next is the Analyte F2 Isoprostane. Now, F2 isoprostane is produced in conditions that result in excessive generation of free radicals, meaning that this analyte measures the level of oxidative stress. Now, this marker has been shown to be elevated in obesity, cardiovascular disease, as well as diabetes. Fasting glucose, which is included in the CMP, along with the hemoglobin A1C, that provides significant information about glucose metabolism. And when it's abnormal, it can be an indicator of prediabetes, insulin resistance, or diabetes. Now, the hemoglobin A1C test evaluates the average amount of glucose in the blood over the past 2 to 3 months by measuring the percentage of what's known as glycated hemoglobin in the blood. Next is the enzyme called lactic dehydrogenase or lactic acid dehydrogenase. Now, this enzyme is found in many cells of the body, including the heart, the liver, red blood cells, kidneys, skeletal muscle, brain, and the lungs. So an elevation in this analyte is associated with a variety of disease states. And remember that environmental toxins can cause damage to the body tissues, which can also tend to elevate this analyte. Next is magnesium. And as you probably know, magnesium is involved in virtually every metabolic process occurring in the body. It's a component of the blood. It's needed for nerve transmission. It's used as an enzyme cofactor, and it's needed for protein synthesis. Magnesium also helps regulate blood sugar levels and promotes normal blood pressure. The magnesium is also associated with the production of glutathione, and as you probably know, that's a powerful antioxidant, and that plays a pivotal role in cellular and liver detoxification pathways. So you need the proper amount of magnesium, and this panel takes a look at it. It's also important to know that magnesium also plays an important role in detoxifying our cells of heavy metals. Here's a couple of great clinical pearls you may want to remember about magnesium. Low serum magnesium is associated with several chronic diseases, including abnormal thyroid function. It's also associated with diabetes, meaning a deficiency. Individuals with fatty liver disease are at high risk for magnesium deficiency. And finally, low magnesium status is linked to both chronic inflammation and insulin resistance. All great reasons to take a look at the magnesium level in our patients. Next is pyruvate. Now, increased pyruvic acid levels has been associated with diabetes mellitus, vitamin deficiencies, uremia, congenital heart failure, liver disease, muscular dystrophy, thiamine deficiency, as well as neoplastic conditions. This test is also used to screen for possible disorders of mitochondrial metabolism and/or problems with energy production. Next is uric acid, and as you probably know, uric acid is produced by the breakdown of proteins. If there's too much uric acid or there's not enough removed, what happens is it can accumulate in the body, causing damage, and particularly to the kidneys. Now, as you know, the presence of high uric acid is known as gout. An increased serum uric acid level is a common finding in patients with hypertension, insulin resistance, diabetes, and cardiovascular disease. Next is urinalysis with microscopy. And as you probably know, many disorders may be detected in the early stages by identifying substances that are not normally present in the urine or by measuring abnormal levels of certain substances such as glucose, protein, bilirubin, red blood cells, and white blood cells. Essentially, the urinalysis is an important tool for assessing the chemical constituents of the urine and the relationship to various disease states such as urinary tract infections, diabetes, and kidney disease. Overall, the urinalysis can detect abnormalities in blood, which can assist in the diagnosis of many conditions. Next is vitamin D 25-hydroxy. And as you know, vitamin D is important for calcium absorption, but it also has received a lot of attention in regard to its role in preventing cardiovascular disease, type 2 diabetes, and helping with immune system regulation. Finally is the Rbc Zinc. Now, zinc is critical for proper thyroid metabolism. Zinc deficiency can result in a decrease in thyroid hormone levels and resting metabolic rate, and all that can lead to weight gain and reduced detoxification capacity. I also want you to remember that a zinc deficient individual tend to have immune dysfunction. So here's the components of the comprehensive detox panel, which include the core analytes I just mentioned, plus 18 additional analytes. Now, the first analyte is apolipoprotein B. And apolipoprotein B is a protein that's involved in the metabolism of lipids and is the main protein constituent of the lipoproteins, such as the low-density lipoproteins and the very low-density lipoproteins. Next is direct bilirubin. And as I said earlier, the comprehensive metabolic panel contains the analyte total bilirubin. Now, bilirubin is formed from the hemoglobin that is released after the breakdown of the RBCs. And an increase in total bilirubin typically means hepatobiliary dysfunction. Now, there are two main components of total bilirubin, which are direct bilirubin and indirect bilirubin. And an increase in direct bilirubin typically indicates gallstones, extrahepatic duct obstruction, or cholestasis. And by the way, the level of indirect bilirubin can be obtained by subtracting the direct bilirubin value from the total bilirubin value. and an increase in indirect bilirubin is associated with certain types of anemia, especially hemolytic anemia, and a genetic disorder called Gilbert syndrome. Remember that proper liver and gallbladder function are needed for proper detoxification. That's why you want to take a look at this analyte. The next analyte is called ceruloplasmin. Now, ceruloplasmin is a copper-containing enzyme. Now, copper is an essential mineral that plays a role in the regulation of iron metabolism, the formation of connective tissue, energy production within the cells, and functioning of the nervous system. And copper is also needed for the antioxidant enzyme superoxide dismutase. Now, what happens here is that the liver binds copper to ceruloplasmin and then it's released in the bloodstream. And about 95% of copper in the blood is bound to this protein. The next test is called the Common Alloy Element Profile. This test is used to check for and monitor for exposure to arsenic, cadmium, chromium, cobalt, copper, lead, mercury, and nickel. Remember that heavy metals are abundant in our environment and can accumulate in the body, causing tissue damage, so it's important to take a look at it. Next analyte is cortisol. Now, cortisol, in combined with DHEAS, which I'll be talking about next, provides significant information about adrenal function as well as immune system function, since the two systems are interconnected. Next is the hormone dehydroepiandrosterone, DHEA. Now, DHEA is produced almost exclusively by the adrenal glands, with small amounts being produced in ovaries and testes. Now, DHEA is useful in determining whether the adrenal glands are working properly. The next assessment is that of iron metabolism. Now, aside from assessing the nutritional status of this mineral, the iron panel assesses for such conditions as iron deficiency anemia, excess iron supplementation, and iron metabolism conditions such as hemochromatosis. The next analyte is known as Fibrinogen Activity, or Factor 1 activity. Now, this analyte evaluates the part of the clotting process in which the soluble fibrinogen is converted into fibrin threads. The next analyte is the folate Rbc, red blood cell. Now, this is used obviously to measure the amount of folate and also to monitor folate therapy. It's also important to know that methylfolate is critical for methylation, which helps to optimize a large amount of processes in the body, including proper detoxification. The next analyte is gamma-glutamyl transferase, or GGT. Now, this enzyme is found in many organs throughout the body, but the highest concentrations are in the liver. Now, GGT is elevated in most conditions that cause damage to the liver or bile ducts. What this enzyme does, it participates in transferring amino acids and peptides across the cellular membrane, and it's also responsible for extracellular metabolism of glutathione, which, as you know, is a main antioxidant, and is involved in phase 1 and phase 2 detoxification of the liver. Next is homocysteine, and homocysteine is an amino acid that is typically present in small amounts in the cells of the body. Now, the body normally converts homocysteine pretty quickly to other substances, and it needs vitamin B6, vitamin B12, and folate to do that. The next analyte is fasting insulin. Now, measuring fasting insulin when compared to fasting glucose, that's going to give you some significant information about the possibility of insulin resistance, diabetes. Next is a look at the lipids, or the lipid panel. Now, lipids, as you know, are a group of fat and fat-like substances that are important constituents of the cells and also a source of energy. The lipid panel measures the level of specific lipids in the blood, and two important lipids, cholesterol and triglyceride, are transported in the blood by what's known as lipoproteins. Now, each type of these lipoproteins, they contain a certain amount of cholesterol, triglyceride, protein, and phospholipids. Now, total cholesterol, that'll give you the measurement of all cholesterol and all of the lipoprotein particles. The high-density lipoprotein cholesterol, that's a measure of the high-density lipoprotein particles. And it's important to remember that HDL is a lipoprotein that takes up the excess cholesterol and carries it back to the liver for removal under normal circumstances. Now, low-density lipoprotein measures the cholesterol and the LDL particle. And it's important to remember that the oxidized LDL particles, those are the ones that will build up in the arterial walls, contributing to hardening of the arteries. Next is triglycerides, and that's a measurement of all the triglycerides in the lipoprotein particles. And as you probably know, a high level of triglycerides in the blood is associated with an increased risk of developing cardiovascular disease. Now, having said that, the next analyte down is known as lipoprotein A. Now, what that is a lipoprotein that consists of a low-density lipoprotein, but also has another protein attached to it called apolipoprotein A. Now, lipoprotein A, it's similar to the LDL cholesterol, but it does not respond to typical strategies of lowering LDL, such as diet, exercise, and most lipid-lowering therapies. And since the level of the lipoprotein A appears to be genetically determined and not easily altered, the presence of a high amount of lipoprotein A is used to identify individuals who might benefit from more aggressive therapy. Next is phosphorus. And phosphorus is a structural component of bone and teeth, but it's also essential for DNA, RNA, and ATP production. Phosphorus is also part of the cell membrane. What you need to know about phosphorus as well is that it also acts as a buffer for acid-base balance, and deficiencies can be seen with malnutrition, malabsorption, acid-base imbalances, and conditions that affect the kidney. Now, phosphorus excesses may be seen with increased intake of minerals, low blood calcium, and with kidney dysfunction. And remember, proper kidney function is needed for proper elimination of toxins, so please keep that in mind. Next is the Thyroid Profile Two. Now, that Profile 2 contains the analytes thyroid stimulating hormone, free thyroxine index, T3 uptake, total T3, and total T4, along with the metabolically active thyroid hormones, free T3 and T4. Now, this panel is going to provide a comprehensive assessment of thyroid function and thyroid hormone metabolism, and that's important for proper detoxification and proper weight. Next is vitamin B12. Now, as I said earlier, B12 and folate are two vitamins that are part of the B complex vitamins, and they're essential for DNA synthesis, as well as proper methylation for proper detoxification. So here are the components of the comprehensive diabetes panel, which include, again, those core analytes I mentioned previously, plus 12 additional analytes pertinent to the assessment of diabetes. And the first one, as you can read, is called anti-pancreatic islet cell test. Now, this analyte is helpful with the differential diagnosis of insulin-dependent diabetes from non-insulin-dependent diabetes. So it's a good analyte to take a look at. Next is C-peptide. Now, in the process of the biosynthesis or the creation of insulin by the pancreas, C-peptide is formed as a byproduct together with insulin, and what happens is that there's a cleavage of a molecule called proinsulin. Now, what C-peptide does, it fulfills an important function in the assembly of the two-chained insulin. So that's its use. Now, here's a great clinical pearl about C-peptide. The liver does not extract C-peptide. What happens is it's removed from circulation and then degraded by the kidneys. The next analyte is what's known as glutamic acid decarboxylase autoantibody. Now, glutamic acid decarboxylase, that's an enzyme that's produced primarily by pancreatic islet cells. Now, this analyte is going to be useful in the diagnosis of type 1 diabetes, otherwise known as autoimmune or autoimmune-mediated diabetes. This test, what it's going to do is allow for the detection of the presence of antibodies to glutamic acid decarboxylase, which is going to provide early evidence of autoimmune disease activity. So it's important to take a look at this. Next is the analyte called glycomark. Now, this test, what it does, provides an estimate of the patient's post-meal glucose over a 1 to 2 week period. And that's going to make it ideal for intermittent term monitoring of glycemic control in diabetic patients. And here's the deal with glycomark. Now, the glycomark is useful in conjunction with the hemoglobin A1C, and the reason being is that it responds more rapidly and sensitively to hyperglycemia than the hemoglobin A1C. So again, great test to take a look at. Next are what's known as insulin autoantibodies. So prior to clinical onset, type 1 diabetes is characterized by circulating autoantibodies against a variety of the islet cell antigens, including, like I said earlier, the glutamic acid decarboxylase. There's antibodies against tyrosine phosphate and also insulin. Now, the insulin autoantibody test is used to detect for autoimmune destruction of the insulin-producing pancreatic beta cells, and that all leads to type 1 diabetes. The next analyte is known as the islet cell dysfunction group 1 or proinsulin-insulin ratio. Now, the proinsulin-insulin ratio is useful in the management of type 2 diabetic patients because the higher basal proinsulin-insulin ratio in non-insulin dependent diabetic patients may predict acute beta cell dysfunction. So you're looking at a transition of type 2 diabetes to type 1 diabetes by looking at this particular test. The next test is the red blood cell magnesium, and that's used to evaluate magnesium deficiency, in particular long-term deficiency, because it looks at the magnesium level inside the cell. Now, what you need to know is that type 2 diabetes is frequently associated with both extracellular and intracellular magnesium deficits. I went over magnesium before, but as you know, chronic late magnesium deficiency and/or overt low level of magnesium is very common in type 2 diabetic patients, especially those with poorly controlled glycemic profiles. What you may not know is that insulin and glucose are important regulators of magnesium metabolism, and that the intracellular magnesium plays a role in regulating insulin action. So it's important to definitely take a look at that. Next is the Nmr Lipo Profile. Now, this test is an FDA cleared test for use in conjunction with other lipid measurements and clinical evaluation to help in the management of lipoprotein disorders associated with cardiovascular disease. Diabetes and cardiovascular disease are all, these conditions are intertwined. Now, the components on this test include a historical recording of the low-density lipoproteins, a historical reporting of the LDL-C, and also the LDL particle size and number. It also reports on insulin resistance and diabetic risk markers. It has an insulin resistance score. And it also includes the standard lipid panel components that I previously talked about: total cholesterol, triglycerides, low-density lipoprotein, and high-density lipoprotein. What's really outstanding on this particular test is what's known as the insulin resistance score. Now, that's a laboratory calculation that looks at the lipoproteins and comes up with a score of insulin resistance and diabetic risk. So it's very, very helpful. Next is the Analyte pancreatic amylase. Now, amylase is primarily produced by the pancreas and also produced by the salivary glands. And measuring pancreatic amylase activity is of value in diagnosing pancreatitis and other pancreatic disorders. So it's looking for any inflammation in the pancreas. Next analyte is called pancreatic polypeptide. Now, this analyte supports a diagnosis of pancreatic endocrine tumors. The next analyte on this panel is phosphorus, and as you know, phosphorus is a structural component of bone and teeth, but it's also essential for RNA, DNA, and ATP production. The final analyte on the diabetes panel is zinc transporter 8 autoantibodies, ZNT8. Now, this analyte is an autoimmune diabetes marker that is instrumental in the diagnosis of new onset type 1 diabetes. And here are the components of the comprehensive diabesity panel, which include the core analytes I previously mentioned, plus 18 additional analytes that are pertinent for the assessment of diabetes in combination with obesity. So the first analyte is an adipokine called adiponectin. Now, as you know, obesity is strongly associated with the pathogenesis of type 2 diabetes, hypertension, and cardiovascular disease. What you may not know is that recent studies have suggested that adipose tissue plays an important role in the development of these conditions and their complications through a secretion of certain chemicals, like I talked about, known as adipokines. And the one I want to talk about here is adiponectin. Now, adipokines contribute to the pathophysiology of obesity-linked disorders through their ability to modulate inflammatory and metabolic processes in the body. What's known is that a diminished level of adiponectin has been associated with an increased prevalence of obesity-linked cardiovascular diseases, including ischemic heart disease and peripheral artery disease. The level of adiponectin are significantly reduced in obese patients compared to non-obese individuals, and the levels of adiponectin are reduced in diabetic patients compared to non-diabetic patients. Now, here's a great clinical pearl. Weight reduction significantly increases the level of adiponectin. And as I mentioned earlier, apolipoprotein B is a protein that's involved in metabolism of lipids. And an increase in apolipoprotein B is associated again with diabetes, hypothyroidism, kidney disease, and also with certain medications that I mentioned, the beta blockers, diuretics, and progestins. So it's important to take a look at this analyte. Next is direct bilirubin. And as I said earlier, the comprehensive metabolic panel contains total bilirubin. And the reason for looking at indirect bilirubin is to assess for conditions extrahepatic duct obstruction or cholestasis. Also included in this panel is cortisol that I mentioned earlier in one of the other panels. Now just remember that cortisol in combination with DHEA, it's going to provide a lot of information about adrenal function as well as immune system function. And cortisol, remember, affects blood glucose levels. It's going to help maintain blood pressure and help regulate the immune system. C-peptide is included in this one as well. And just as a refresher, as I said earlier, in the process of creating insulin that the pancreas does, C-peptide is formed as a byproduct together with insulin by the cleavage of a molecule called proinsulin. So in other words, proinsulin gets split into C-peptide and then into insulin. And again, the elevated levels of C-peptide are going to be associated with hyperinsulinemia, renal disease or insufficiency, as well as obesity. So it's important to take a look at this. Also included is DHEA, and that's going to take a look at the adrenal glands. Remember that DHEA is almost exclusively produced by the adrenal glands, and essentially DHEA is a precursor for testosterone and estrogens, and concentrations of DHEA are going to affect the concentrations of these hormones and other hormones. And remember, most importantly, that DHEA is involved with development, growth, immune system, and immune modulating, and cardiovascular function. This panel also includes the iron metabolism panel that I mentioned earlier, and it's going to take a look at serum iron levels, total iron binding capacity, and ferritin levels. And I want you to remember that ferritin is an acute phase reactant, so if that's up and C-reactive protein is up as well as fibrinogen, you know that there's an inflammatory process going on somewhere in the body that needs to be addressed. Next is fibrinogen activity test. And as I said earlier, fibrinogen is also an acute phase reactant, as you know, meaning that the level is going to increase with tissue inflammation or tissue damage. Next is GGT, that's gamma glutamyl transferase, and that enzyme has its highest concentration, as you now know, in the liver. And GGT is going to go up in most liver diseases as well as bile duct diseases. And speaking of glutathione, total glutathione is included in the diabetes panel as well. And as you know, glutathione has an antioxidant role. It's a cofactor for many enzymes. It regenerates vitamin E and vitamin C, and also is a part of phase 1 and phase 2 detoxification. This panel also includes the glycomark, which I mentioned earlier. And the glycomark is going to be helpful looking at glucose monitoring and management for a 1 to 2 week period. Next is homocysteine, and as you know by now, vitamins B6, B12, and folate are required for the metabolism of homocysteine. You definitely don't want homocysteine to build up in the body because it's a risk factor for cardiovascular disease, peripheral vascular disease, stroke, and conditions that affect the cardiovascular system. Next is insulin, which is included in this panel. As I said earlier, fasting insulin when compared to fasting glucose, that's going to give you a lot of good information about the insulin resistance, prediabetes, or diabetes, or about the possibility of them existing, as well as the production of insulin from the pancreas. The next analyte is leptin. Now, leptin is another adipokine produced by the fat tissue. Now, leptin can be used for assessment of obesity as well as infertility. Leptin is produced mainly, like I said, by the white adipose tissue, and blood levels correlate with body fat stores. So here's what you need to know about leptin. Now, increased leptin levels stimulate the central nervous system to reduce appetite and increase energy expenditure. Leptin is thought to play an important role in the body's response to food deprivation and starvation. Now, here's how it works. Leptin, again, it's a hormone that helps regulate appetite by signaling hunger satisfaction, or what's known as satiety. Now, this test measures the amount of leptin in the blood to detect a deficiency in leptin that may be contributing to obesity. Now, insufficient leptin can cause persistent hunger as the body attempts to protect itself from perceived starvation. In the obese patient, it's common to find an increased leptin level. Sounds a little counterintuitive, but here's how this works. It is thought due to a resistance of leptin that is similar to insulin resistance seen in obesity. People who are affected with leptin resistance continue to experience hunger even after consuming a sufficient amount of food. And what happens is the body continues to produce more leptin in an attempt to compensate for the response to the perceived hunger. In other words, leptin resistance. The next analyte is lipoprotein A, and as you already know, that consists of an LDL molecule and a protein called apolipoprotein A. Now, lipoprotein A, like I said, it's similar to the LDL-C, but it doesn't respond to typical strategies because lipoprotein A appears to be genetically determined. The next analyte on this panel is the Nmr Lipoprofile, and like I said earlier, this test is FDA cleared for use in conjunction with other lipid measurements, and it includes the historical reporting of the low-density lipoprotein cholesterol as well as a low-density lipoprotein particle size and number. It has that insulin-resistant and diabetic risk markers on there and that insulin resistance score, which is extremely important to take a look at. And remember that it also contains a standard lipid panel components such as total cholesterol, triglycerides, LDL, and HDL. Phosphorus is also on this panel, and like I said earlier, phosphorus is a component of bone teeth and is essential for DNA, RNA, and ATP production. And the final component on the diabetes panel is the thyroid profile. And this profile includes a TSH, free thyroxine index, T3 uptake, total T3 and total T4, as well as the metabolically active thyroid hormones, free T3 and T4. And this profile is going to give you that comprehensive look at thyroid function, thyroid metabolism, which is important for proper metabolic rate of the body. And remember that a low metabolism is associated with weight gain and obesity, as well as a potential decrease in detoxification capacity. So I want to leave you with a great clinical pearl that I learned several years ago. And you need to realize that many experienced integrative clinicians often see overlapping signs and symptoms of metabolic disease, endocrine disorders, immunological disorders that are associated with chronic disease. So blood sugar dysregulation, food allergies, thyroid disease, hormonal imbalances, gastrointestinal disturbances all appear to have many of the same symptoms when it comes to chronic disease. So please be aware of this tendency, because disturbances or dysfunction in any part of the body systems can adversely affect one or more of the other body systems. That's the reason why you want to take a look at these panels.
Thank you for that valuable insight, Dr. Sedano. We will now briefly review where to locate the ready-to-run Avexia Diagnostics panels. When you log into your Avexia account, you are automatically taken to the dashboard. From here, click on the Test Menu tab at the top of the page. You will then be directed to the Avexia Diagnostics test directory. Although you can enter Avexia into the keyword search box, you can simply click the quick link labeled Avexia Panels under the Featured Panels and Tests column on the right, which will bring you to the different categories of ready-to-run Avexia panels. At the top of each category page, this helpful resource provides a general, overall description of why the testing is important, followed by the list of available panels in the category. Scrolling further down the page is a comparison chart. Each panel from the category is listed at the top and can be clicked to be taken directly to a detailed information page specific to that panel. Moving from left to right, you will notice the panels become more comprehensive and encompass greater clinical insight. Test biomarkers are listed in the left-hand column, allowing you to see a breakdown of the analytes included in each panel. These are also clickable links that will take you to informational pages for each biomarker. These pages provide easy access to more specific details like the turnaround time, CPT codes, specimen type, stability, and an overview of the test. If applicable, individual analytes are also listed under the Components tab below the test name, and any particular instructions are listed under the Collection Details tab. Now let's briefly review how to order these panels. First, log into your Avexia account and click on the Avexia link option under the column labeled Quick Links on the left-hand side of the dashboard. Next, find your desired patient or create a new patient. Then, click the button labeled Add New Order to open the test menu and select the appropriate panel or test. Add it to the cart by simply clicking the plus sign on the left-hand side. Finally, preview and confirm your order once it has been added to your cart, and complete the process by clicking the Place Order button. You can reach us during our extended business hours between 8 a.m. and 8 p.m. Eastern Time, Monday through Friday, by calling 888-852-2723 or contact us anytime via email at info@avexiadiagnostics.com. We are always happy to assist you with any needs or questions that you may have. Thank you again for joining us for this presentation. Until next time, from everyone at Avexia Diagnostics, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.